In the comment section, my subscriber dropped, Nurse Mercy Mary, I was recently diagnosed of endometriosis. Can you please make a video on endometriosis so I get a better understanding? Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today, we are going to be talking about endometriosis. What is endometriosis? What are the causes? What are the signs and symptoms? When should I see the doctor? But before we go into details in today's class, if you are new on our YouTube channel, please click on that subscribe button, turn on that notification bell so you don't miss out. For all our returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, today I'm going to be talking about endometriosis for that particular subscriber that asked about it. So what is really this endometriosis we keep hearing about? Endometriosis is simply a condition in which tissues similar to what is found in the uterus, tissues similar to what is found in the womb, now start developing in the fallopian tube, now start developing in the ovaries. Are you confused? Just wait a little. Let me explain. You see the uterus, you see the womb. You can see it on the screen. It has three layers. It has the outer layer, it has the inner layer, and it has the middle layer. That inner layer of the womb, that inner layer of the uterus is known as the endometrium. Endometrium. So that inner layer has a tissue that is found there. So tissues like that, tissues that are found around that endometrium, if they start developing in the fallopian tube, they start developing in the ovaries, that same tissues that are supposed to be in the ovaries, they now start developing in other places outside the uterus, outside the womb, then we say that person has what is called endometriosis. In a layman's language, I've been explaining it in my videos. I used to say endometriosis is simply a condition in which tissues that are supposed to be inside the womb, they are not developing outside the womb. They are not in the ovaries and they are now in the fallopian tube. Endometriosis has a lot of signs and symptoms. The major signs and symptoms or the major sign to know that an individual has endometriosis is pain. Yes, this individual battles with pain. The first pain is that this individual start feeling pain in the lower tummy. The lower tummy, the pelvic area, there is pain around that area. This individual normally have pain during or after sex. This individual has pain. Also, period pain for those that have severe period pain, that even stop them from carrying activities of daily living. They cannot even function effectively well during their period. That might be a sign of endometriosis and you might need to see a doctor. And also, pain when passing urine, pain when pooing. You want to poo, you want to pass out urine, you are having pain. That might also be a sign of endometriosis. Fatigue, always feeling tired, always feeling weak. Constipation, diarrhea, that might be a sign of endometriosis. Then also difficulty getting pregnant. That might be a sign of endometriosis. But in all, these are just signs. But to get a definite diagnosis, you are going to meet your doctor and the doctor will tell you the appropriate test to do to find out if it is really endometriosis or something else entirely. So then that take me to talk about the causes of endometriosis. What are the likely cause of endometriosis? The first one I have to share with you is genetics. But before I say genetics, I want you to know that the major cause of this endometriosis is not known. But it is usually linked to genetics. If there's somebody having endometriosis in a person's lineage, in the history, they might be at risk of coming down with endometriosis. Then another is problem with the immune system. We all know that the immune system is what helps us fight bacteria. It was help us fight infection. It was makes us active. Like it must makes us like a soldier. The immune system is a soldier that helps protect and defend the body. So when there's a problem with the immune system, that might lead to endometriosis. Then the third one I have to share with you is the blood or lymphatic system transport. The blood can transfer these tissues. The lymphatic system can also transfer these tissues tissues to the various places, to the ovaries, and to other parts of the body. So these are factors that are linked to the various causes of what endometriosis. But remember, the exact cause is not known. For me to say, oh, when you do this, you can prevent endometriosis. Don't do this, you won't get endometriosis. The exact cause is not known. Then you may want to ask, how do a doctor diagnose this person has what endometriosis? When you are showing these signs and symptoms, the next thing, like I earlier said, is to visit the doctor. So a scan might be done, a CT scan might be done, a laparoscopy might be done, pelvic examination might be done, and the doctor will tell you, oh, we just discovered you had endometriosis or not. For the person that did that asked the question, I hope you are getting a clue of what endometriosis is all about. So it's not in your power, I would say, to actually prevent this endometriosis, because we don't really know the cause, the actual cause of endometriosis. That takes us to the various treatments for endometriosis. The first one I have to share with you is pain. Yes, it is painkillers. Painkillers. We have to take a lot of painkillers to actually let go of the pain. For example, paracetamol, ibuprofen can be taken. But if it becomes severe, kindly see your doctor. Then the second one I have to share with you is hormone method contraceptive. There are some kind of hormones replacement that can be given to you, but your doctor is in a better position, like I will always tell you, to tell you what to do. I'm just here to educate you and to give you a general knowledge of what this disease condition is all about. Then also, a surgery can be carried out to reduce that, to cut those tissues away. That's to remove those tissues, to trim it like a trim, remove those tissues. While a surgery might be carried out to totally remove it. It could be hysterectomy that might be done. But in all, when you discover these signs and symptoms I just listed, see your doctor. The doctor will be in a better position to tell you the exact test to do, and he will also be in a better position to tell you the best treatment that suits you. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye, and see you in our next video.